Welcome. I have a great self-help stretch exercise to remove lower back pain, particularly in the sacroiliac region or off to the side. Now, I'm going to come back to this in just a second, but briefly, we spend so many hours in a seated position in our car, at work, at home, watching TV, in front of a computer, and when our knees are bent up like this, the hip flexors, the iliopsoas, the deep hip flexors that attach, as you can see here, to the lower lumbar vertebrae, they cross the pelvis and attach into the upper hip or thigh region. Well, as a result of this excess of contracture, this indirectly affects the lower back muscles and can cause pelvic tilting. It can cause rotation of the pelvis in this way or this way or this way. Understand that when you look at the pelvis, these are individual joints. These are the sacroiliac, and they can move individually from each other. But what happens is when those psoas muscles become contracted, we then start getting a lot of compensatory changes of other areas in the lower back. So generally, when people have pain in their lower back, it's usually off more on one side than the other. So the simplicity of this particular exercise is to do one simple stretch, amazingly, that you can be out of pain literally within 10 to 15 seconds. But if this technique does not work on you, or you say, well, I didn't really feel much, well, you gave it a shot, you had nothing to lose, and it will not hurt you. So let's get to the technique and the stretch, and hopefully you'll be amazed. Well, very simple. I have discomfort in my left sacroiliac, left lower back area. I do lots of sitting, and understand just sitting in your car with this left knee bent a lot and the right leg straight, because you're operating the gas on the right leg and you're using the brake on the left leg, and so the majority of time your left knee is bent. Now, just having the left knee bent, what does that tell us? That tells us that the iliopsoas, or the hip flexors, is more contracted on the left more commonly than the right. Although this can cause a lateral pelvic tilt, as well as that contracted psoas is shortened. So what are we doing? We're going to stretch the psoas muscle and put stress along that sacroiliac region to stretch out those muscles. And hopefully, as you do the stretch, while you're doing it, you should feel relief. So all we're going to do is lay back on our back, get close to your bed or something that's firm, like something you can lay on. But you need to be close to the side of that table or side of that bed. All right, massage table, bed, hard couch, whatever you're at. But you cannot be on the floor because you're going to be dropping the leg down. Okay, so it's my left lower back. Lay on your back. Hold on to that area. Stay at the edge. And what I want you to do, I want part of your left buttocks off the side of that table, and I want you to drop, look at my toe here, I want it faced outwards like this, facing outwards, and I want you to drop the leg down. Just let it drop down. So down and out. Okay, you see down and out. You see here? Okay, down and out. And just let it hang there. Okay, and right away you're going to feel that stretch. You're going to feel it open up, and you're going to say, oh my goodness, amazing. You can feel that whole area immediately open up because we're stretching the iliopsoas, the hip flexors, as well as stressing that lower back area to relieve irritation along that nerve and to ease those muscles up. Just hold it like that and just let it dangle down. Don't even lift it up. Just let it fall down like it's dead. Just let it fall down about 25, 30 seconds, and that's it. And if you want to do it again, remember the toe goes outwards and you just drop it off the table as you lay on your back. And as it's coming down, you may say, oh my God, do I feel relief? Because if you have a sacroiliac area and it's located more right in that joint area, that's going to give you a lot of instant relief. Amazing, because this is knowledge that you can take anywhere when you travel throughout the world. Listen, I really hope it helps you. Please leave your comments below. I'm curious how well and how fast it helped you. Share this video with others, because there are so many people out there who need to get education about their particular health and pains. I ask you to subscribe if you haven't, so you can continue to receive the best of the self-help videos here on the internet. And most important, Make it a great day. I'm Dr. Alan Mandell.